From South Dakota.
Mr. President, I wish to add to the comments that were made by my colleague from Wyoming, who in his former life, being a physician, understands this issue probably better than any of us here in the chamber. And I think he very eloquently pointed out why this amendment that we're hopefully going to be voting on that will repeal the health care law is so important. Obviously there's a big debate that's been raging in the country over the past year about this legislation as it was being considered here in the Congress. And I think the one thing that is clear about the public's view of this is they think it was a bad idea. And that hasn't changed. That was true a year ago, that was true 6 months ago, and that's still true today. And I think that the administration had tried to argue that they had merely done a poor job of communicating to the American people how great this health care reform idea was. But that excuse misses the point entirely. The American people, Mr. President, are not clueless. They know a bad idea when they see one. And they understand that the Democrat health care plan was a bad idea. And despite the administration's full-court PR press in trying to reverse the public opinion about this, the health spending law remains unpopular in polls. In fact, as was quoted by my colleague from Wyoming, there was a poll that came out today where 58% of likely voters in a recent Rasmussen poll favor repealing it. In fact, if you drill down a little bit further into that survey, it says 47% strongly favor repeal. 38% oppose repeal, 29% strongly oppose repeal. But you've got a decisive majority in this country, 58% of the population saying they would like to see this repealed, and nearly half strongly committed to that position. So notwithstanding efforts by the administration to reverse the public's view of this, the American people still get it. And I think that the administration had hoped that this would get behind them, that people would start, once they were educated about the benefits of this, come to a different conclusion. But I think they see clearly now that that hasn't happened, that hasn't been the case. So this whole health care law has failed the test of being something that the American people think is important, something that they want to see done. Now, I don't doubt for a minute that they want to see the issue of health care addressed in this country, health care reform. Unfortunately, this particular proposal didn't do anything to reform health care. It expanded health care dramatically, and it expanded the cost that most people are going to bear when it comes to paying for their health insurance premiums. And so it failed the test of public support of the people in this country who have been following this debate very carefully because it affects them in a very personal and profound way. Health care is something that every American understands. It's something they get, and regrettably, they have turned I shouldn't say regrettably, it's regrettable that we passed it. I think the American people have turned a thumbs down on it, and that should speak to the importance of this amendment in us trying to go back and do this the right way. The other test that it failed, which everybody here talks about, and there's a great deal of lip service and a great deal of rhetoric paid to the issue of jobs. And honestly, I think if there was a message coming out of November's election, it was this: the American people want us focused on three things. They want us focused on jobs, they want us focused on spending, and they want us focused on debt. Now, on the issue of jobs, this also fails the test. Why? Because it raises taxes so dramatically. If you look at the tax increases in the bill, $569 billion in taxes on virtually every sector of the American economy. For instance, the measure penalizes employers for hiring more workers by raising the Medicare payroll tax by $210 billion, leaving new taxes on many small businesses that will serve as the engine of economic growth and job creation. And if we want to get this economy recovering again and creating jobs, one thing you don't want to do is impose new mandates, new burdens, new taxes, new regulations on the economic engine, the job creators in America today, and that's our small businesses. And so the issue of jobs, if we're serious about jobs, this certainly didn't do anything to create jobs. And I think the American people made it very plain and very clear: we want you focused on jobs. We want you exclusively focused on getting this economy back on track, creating jobs, getting the American people back to work. So it failed on that test. How about on the test of spending? Well, you know, if the American people, I think, understand a very sort of basic, sort of adage, if you want to call it that, and that is when you're in a hole, you don't keep digging. And what we have done is we have dramatically expanded the size of government at a time when we're running year over year trillion-dollar deficits. So what did this do? Well, when it's fully implemented, it will increase spending by $2.6 trillion. That's the 10-year score between 2014 and 2023. It's a massive expansion, the most dramatic expansion that we've seen of government literally since the 1960s. And so it doesn't do anything to address the issue that the American people spoke loudly about, and that is getting Washington spending under control. Now, arguably, as I said before, I think they care deeply about the issue of health care and getting health care costs under control. As I'll get to in a minute, this doesn't do little, if anything, to address their health care costs, but it certainly increases federal spending and increases the role and the size of government at a time when most Americans are saying, we want the government reined in. We want less government. We want the government to start living within its means. Instead, we've increased and expanded the size of government dramatically. Now, how about the issue of debt? A lot's been made by our colleagues on the other side that if we were to repeal this, it's going to add to the deficit. Well, let's go back to the reason why they can make that argument, Mr. President. And the reason they can make that argument is because of all the gimmicks, all the phony accounting that was included when this bill was passed in the first place. We've all referenced and talked about the double counting of Medicare savings to the tune of about $400 billion, new payroll taxes, savings that are supposed to be achieved by reductions in Medicare spending, double counted both as a pay-for, an offset to pay for the new health care entitlement program, and as a credit to the Medicare Trust Fund. You can't double count. You cannot score these things in a way that dips into the same revenues twice, Mr. President. And that was one of the great, I think, ironies of this legislation when it was being debated here, that issue did not become more fully discussed. The way that this thing was accounted for and the way in which the trust funds were credited with saving or extending the lifespan at Medicare at the same time that the same dollars were being used to pay for this new health care entitlement. You can't spend the same money twice. And that's exactly what happened. And the American people get that. I cannot feature any other place in America where you could get away with what happened here during the health care debate. So you had the $400 billion, $398 billion to be exact, that was double counted in Medicare. You also had $29 billion in Social Security revenues that were double counted as well. The Social Security Trust Fund was credited with $29 billion. At the same time, the revenue that was coming in from higher Social Security payroll taxes because of some changes that were made in the legislation was counted to pay for the new health care entitlement. So you had Social Security and Medicare payroll taxes that were double counted, that were essentially scored twice to credit the Social Security Trust Fund, the Medicare Trust Fund, at the same time they were being used to finance the new health care entitlement. Add in the $70 billion that was listed as revenues to pay for this from a yet new entitlement program called the Class Act, which is a long-term care entitlement program. And as was described by my colleague from Wyoming, even the Senate Budget Committee chairman, the senator from North Dakota, described the Class Act as a Ponzi scheme of the highest order, something that Bernie Madoff would be proud of. And yet $70 billion was scored as being used as a revenue raiser to pay for the new health care entitlement program, knowing full well that at some point in the future, the people who paid premiums into this new program were going to demand some sort of, when it came time to stake a claim against that trust fund, that those benefits were going to have to be paid out. So in the out years, it dramatically expands and explodes the deficit, even though in the near term it was counted as revenues that were used to shield the true cost of the health care bill. Well, if you add in the cost of implementation, which turned out to be about $115 billion, something that wasn't discussed or included in the debate, nor was it included in the initial CBO score, you have about $208 billion cost to do the doctor's fix, to take care of the physician fee issue, which will be coming to us and which was left out of this bill so as to understate the true cost of the bill and to put it into balance. My point, very simply, Mr. President, is by any objective measure, If you look at the games that were played, the gimmicks that were used, the phony accounting that was used to claim that somehow this was going to be a positive impact on the deficit, it just doesn't pass the smell test. No rational American would look at this and say, this makes any sense at all. Now, in fact, if you add up everything I just said, if you take all these accounting gimmicks, all the phony accounting that was used here, and you offset that against what is claimed as a budget savings in this, you actually get not a $143 billion savings, you get about a $700 billion deficit. That's what we'd be looking at over the 10 years. Now, remember also that you also had the 6 years of spending in this bill in the first 10-year window, which is what the CBO used to score this, and about 10 years of revenues. So the tax increases start right away. The revenues are counted immediately. The spending doesn't come until later. You front load the revenue, you back end load the spending in that decade, and try and claim that somehow this thing balances out. Again, the American people see through this. They get it, which is why they have taken the position they have on the health care bill in the first place. So on the test of debt, on the test of how does this impact the deficit, how does this impact America's long-term fiscal standing, this bill is a failure. One other point I'd like to make, because again, I wanted to come back to it earlier. I think a lot of Americans were hoping that when Congress took on this issue of health care, that it actually would be with an eye toward reducing the cost of health insurance premiums for most Americans. What we're seeing is the contrary. Actually, what we predicted would happen is coming true. Many of us who were involved in that debate said at the time that this thing was going to lead to higher health care costs for most Americans, and it's actually true. And actually, the CBO said the same thing. They said that the individual health insurance premiums would increase by about $2,100 per family as a result of the new law, and that some consumers would face total premium increases of more than 20%. Well, those are things that we're seeing come to fruition now. A lot of people are seeing their health insurance premiums go up. That's just a fact. It's a reality. It's complete contradiction of what was promised when this bill was being debated, but you have not only higher taxes on small businesses that are costing us jobs, that are destroying jobs. You have this massive expansion of spending. You have the debt and the deficit, which in the out years is going to explode because of all these accounting gimmicks. And then when it's all said and done, you still haven't done anything that lowers health care costs for most Americans. And I believe that most Americans, that's what they wanted to see come out of a health care debate in the Congress. They wanted to see reforms passed that put downward pressure on health care costs to them and their families rather than increasing it. And in fact, what we've seen is the opposite. It hasn't decreased costs, it has increased costs, and I think you're going to continue to see costs go up because as these tax increases start to kick in, a lot of these businesses around the country obviously are going to pass these costs on to the American consumer. And so it fails the test of doing anything really to lower costs for most Americans. Finally, Mr. President, it also, I think now, is failing the legality test. As you're seeing now, these courts are coming out and determining that this whole exercise was unconstitutional. And so that triggers a whole nother debate in this country, a debate that I think we're going to watch probably for a while, but I hope as this thing moves through the courts that it does engage the American public about what is the role of the government and how intrusive should it be and what kinds of mandates can it impose on the American people. It was a very well-reasoned decision that came out of the Florida court yesterday, which says that this legislation is unconstitutional. And again, that makes the argument that many of us were making as this was being debated last year. But the bottom line is, we are in a position to do something about it. This isn't the end. This shouldn't be the end of the debate. We should look at this as an opportunity. If the amendment that was offered by the senator from Kentucky, Senator McConnell, actually were to pass and we were to repeal this, we could start over. We could go about this in a way that actually does reform health care in this country in a way that lowers costs rather than raises costs for most Americans. And I think that would be a welcome thing for the American people. Now, the other side is going to argue we don't need to do this, we don't need to repeal this, we just need to, quote, repair it. We can make these little modifications to it. But the fundamental fact, Mr. President, is this was a mistake in the first place, and we should acknowledge it. And I think, again, the fact that it passed last year on a total party line vote, a total partisan vote, there wasn't a single Republican here in the United States Senate that voted for this. And usually when you're doing big, bold things, if you look historically in this country, it's done in a bipartisan way. It's done in a way that incorporates the best thoughts, the best ideas, the best input from both sides. And you generally get a bipartisan vote in support of something like that. This was passed, party line vote. It's now facing a challenge, and I think a very direct challenge in the courts, which is going to play out over the course of the next several months. But we here in the United States Senate could do something by repealing this law and starting over and going about this the right way. And that isn't to say for a moment that there aren't issues that need to be addressed with regard to health care in this country. And many of them have been touched upon by speakers who've come down here before me. But there is a better way to do it. There is a way to do this that doesn't dramatically increase the size and expansion of our federal government, that doesn't add and explode the debt in the out years, that doesn't raise taxes on our small businesses when we're asking them to create jobs, that actually does lower the cost of insurance, health care insurance for most people in this country rather than increasing it, and is done in a way that's consistent with what our framers intended in terms of the basic parameters that are allowed by our Constitution. And so I would hope, Mr. President, that the McConnell amendment will get voted on. I think it's important for all of us, obviously, to be on the record on this, but I would hope that my colleagues on the other side might reconsider the position that they took when this was voted on last year and conclude with many of us that this was a failure and that starting over is the very best solution for the American people if we're serious about giving them a health care system in this country that is affordable, that delivers the high quality that they expect, and enables them to have the maximum amount of choice in decision-making authority when it comes to something that is so personal and so important to them, and that's their health. Mr. President, with that, I yield the balance of my time.